Well, thank you very much for inviting me to tell you a little bit about what goes on at Kew behind the scenes in the gardens. And today I'm really going to concentrate on some of the work that we do. I'm going to talk about some of the work that we're doing on the medicinal plants at Kew. And it does very much fit in to Kew's science strategy. New director of science coming in 2013 really wanted to have a focus on getting a lot of our information that we have at Kew out into the public, and also kind of looking at how we can enable those collections at Kew to be used in ways that can influence and support some of the investigations going on to the critical challenges that we face. And one of those is looking at medicines for the future. So this talk is in that context, but it takes into account what I've been involved in. Quite a few years now I've been at Kew. I came for a 6 months postdoc to study kind of aspects associated with Parkinson's, and kind of found that you could do a heck of a lot at Kew that you really couldn't do in other places, and over the years have stayed and had a really fascinating career there. The beginning of my time there, we concentrated on a few plants which we studied in detail. So this is kind of 85, etc. And we did work with the pharmaceutical companies. We were looking at diseases for HIV, some work for cancer, diseases of the central nervous system, etc. Well, I'm pleased to say with some success. But again, you get into the 1990s and you get a lot of those companies coming together. The pretext of all our work was, because a charity is the ability to publish. That's absolutely key. So although we work with companies, our contracts with them give us the right to publish. But of course, if a patent's involved, we would protect that. But at the end of the day, that gets out into the public domain anyway. And the other key thing at Kew is, because the plants that we work on come from different countries, that there is benefit sharing agreements in all our contracts. That means that the country from what that plant material will benefit. Sometimes it's financially, but otherwise definitely with regards to involving them in aspects of the research. So, but then with the merger of companies, etc., we started to focus on other things. And we started to really focus on helping to identify material that was getting out in the public domain, that was being used by companies for cosmetics, for medicines, etc., but less on the discovery. And that's partly because the companies and research agencies were having less of an emphasis on natural products as leads. They'd gone more into computational chemistry, etc., organic chemistry for already developing leads, or things like vaccines, which are not our expertise. So we started to look a lot of authentication of plants entering the trade. And more recently, we're kind of doing that, but we're also back into discovery. So that's kind of the history of, over the years, since the mid-1980s to the current day, studying about 28,000 different plants in the process. Now, that backlog of data becomes very important because it starts us really reinventing something that's already known, so we don't waste time because we've got that background information. So we're not just dealing with information. Kew produces chemical data. We have the ability to chemically identify the compounds in the plants. We also do some of the testing, call them bioassays, looking for, say, got some cancer screens. We also have other assays that can be used for cosmetics, antibiotics, and work we do with insects. We sometimes use insects as models for different diseases. But we work very much in collaboration with medics and other biochemists, etc., at other organizations, because if we're going into something like cancer, we can do the screening, but that's not our expertise. It's very important we work with the experts who really are, at the cutting edge of knowing when we've got something that actually is novel and worth looking at. So over the years then, there's been this link with trying to understand a traditional use of a plant. If it's been used as a medicine, does it actually have any validation in it? Can you explain how plants have been used? And therefore, working with communities is also been our key. If you've got 5 or 6 plants that can be used, say, for treating antimalarial, does it actually matter which one you use? Or maybe they're all not very good. Maybe they're treating fever, not actually plasmodium associated with malaria. So having that better understanding has taken us on different projects. And today I'm just going to talk about a few of those. UK example in Ghana, South Africa, and China. So if you go back in time, this would have been kind of our pharmacy. Every pharmacist would have had a cabinet like this, a Materia Medica, that they would have used as the standards. And we were quite interested when we started to look at the plants that are in these Materia Medicas, that actually we don't know a lot about whether they work or not. Each one of these would contain about 200 to 250 different plants. About, say about 75 of those we would know something about the chemistry to explain their activity. So we could see that a lot of what was our traditional medicine was a little bit of a black art. When we started to look at the Materia Medicas that had been around, we were interested to see, well, actually what's lost? Because if you go back to the 17th, the 18th, and the 19th century, uses of plants in Britain, it's actually pretty well documented. If you come nearer to the start of the National Health Service in 1948, it becomes a little bit woolly to find actually what was being used in the UK. So we started this project with the National Institute of Medical Herbalists. In fact, it was a lady from that institute who really came up with the idea. And it was done at Kew, Edinburgh Natural History Museum was also involved, Chelsea Physic Garden, and the Eden Project. And that was going out and talking to people about the traditional uses of their plants, especially prior to 1948. So it became known as Remembered Remedies, or its more scientific title, Ethno Medica. So this is just one of the cards that was filled in. The back of it would have had details about the person. And for any record to have been put on the database, we needed to have, so to speak, an owner of it. So it wasn't going out and just getting spurious information. So here is a card that's been filled out about hawthorn, been used in a tonic, etc., and how it was used. Very simple information, but when you start to get it, you see trends coming in. You see trends for plants that were used, say, in Cornwall, up in Newcastle, etc., and they're different. Different things being used for similar types of conditions. Now, this information is available at Kew, and we're in the process, as part of our science strategy, of trying to get this now out into the public domain. So it's not just for those who have access to Kew can actually use this database. So we found information in UK for 280 species that were being used, collected data from over 6,000 records. Actually, it's nearer 7,000 now. And you could see general things that came out, onions being used, antibiotics, for treating inflammation, etc., cabbage, salvia memory, willow pain, salicylic acid, etc., dock leaves, galium, and figwort. Right, so we have this background, and we managed to get some money to be able to study some of these traditional remedies. Could we actually explain the use? Again, it was quite surprising because we thought there was more information out there about some of these plants, about the chemistry. And I think we've fallen into that trap of always looking at somebody else's back garden rather than your own. So studying the plants from the Amazon or from more exotic areas was traditionally what we were doing at Kew. We weren't really doing anything on the UK flora. It was actually the Millennium Seed Bank project down in Waco's Place, where we had a focus on collecting seeds from the UK. There was a bit of a trigger for this particular project. So, why not study the actual chemistry of some of the UK plants? So again, we go from the tradition, so something like hawthorn, infusion's good, for your heart. Well, what's behind it? Now, there are some chemicals that could explain it, but we actually couldn't find anything really solid to explain that. Different on onions. Here, kind of the inside of an onion is going to be placed on cuts and scratches. It acts like an elastoplast with an added healing aid. Now, we do know that some of the compounds from onion do have mild antibiotic activity. You can show that in the lab, and you can therefore explain some of these uses. And it also has some polysaccharides that enable it kind of to stick on the wounds, giving it kind of a elastoplast activity. Another one was Figwort, used in parts of Norfolk down into Cornwall for leg ulcers. And on this particular one, we were able to show that the activity was associated with a group of compounds, mostly these iridoids. Now, initially when we started, we lost activity. We couldn't find the activity. We thought, okay, this one, it's one of those uses where we can't explain. We noticed it had been used by talking to people who were still using it. It's always used fresh. And the mistake that we made in the lab is that we were using it dried, so we gathered the material and then we worked on it kind of at our leisure. What we did is we went and we got some material fresh. We got it frozen on site with liquid nitrogen, which stops the enzymes that break down some of the active compounds. And through a process of then chemically profiling that and then doing kind of manipulations on how we extracted it, we identified some of these iridoids that are present in the fresh material, and that's why it's actually replaced every two to 3 days. They're some of the actives. So again, paying attention to how something is used. So here we're not talking about developing new drugs. We're just really trying to explain what's in these plants that could potentially be useful. And gallium is another one where it's used for wounds, etc. And again, we could explain the chemistry as to why this could have mild activity. Elder, another one, infusion. Flowers before bed, help to cure winter colds. I tell you, this one is really only good at very, very early stages of a cold. And we were able then to get some further money, actually, from one of the research councils, EPSRC, along with Procter & Gamble, to do a further study of this. And we identified a range of compounds in this that do have antiviral activity. And some of these are present in, say, fruit cordial. Not talking about a drug here, but a mild activity. If you had a few glasses of good quality elderflower, it's the quality that's going to be important here, it would give you enough to give you a little bit of protection. But again, it's no cure. I mentioned sage earlier. For memory, we did a study of quite a few plants and found that Melissa had activity, again, working with collaborators at King's College for potential activity for maybe Alzheimer's. And we managed to get some funding. This is my colleague, Melanie Howes, who's part of the team at Kew, to do work on the chemistry of this. And we managed to save money to do a double blind placebo experiment. Now, the results of that showed it didn't have activity that could be attributed, you could say, to Alzheimer's, but it did have an effect on agitation for those patients who did have Alzheimer's. So we're now doing more work to actually identify what is that chemical profile, because this is just kind of a chemical fingerprint We've identified some of the compounds. But what are the key chemicals that are associated with that effect on agitation? Again, we've got some further funding to be able to support that work. So then kind of moving out of UK, abroad, say parts of Africa, and you look at some of those stalls and you kind of think, would you take any of those medicines? I mean, it's very different from our nice little cabinet that we would take. Almost likely none of you would take anything on that back row. But think about, some of the material that's used, the tips of those spears. Whoopsie. Oh. I had it a minute ago. Tips of those spears have enough toxic compounds, again, derived from plants, and we know exactly which ones, to cause the animal to fall down without tainting the whole of the flesh, to actually have an effect on you so you can eat the meat. How's that information being passed on? How do they know more about the dose? And again, working with some of the communities, we've been investigating that, and we'd like now actually to do some further work on the alkaloids, some of the compounds that are associated with these aerotoxins. Again, we assume that was actually more known about them than we find is the case. Now, one project that I often talk about because of its kind of impact on a lot of my research was a project that we did with South Africa. Here, we were invited to take part in this project. It was a community that was suffering from conditions associated with HIV, not always HIV per se. Could we assist them with the cultivation of some material for food, that line between food and medicine, that they would be able to grow? And the key reason was they no longer had access to some of the land because of increase of tourism and big game farms, etc., in that part of South Africa. So the people that were collecting the traditional material hadn't got access to that. So the traditional healers were having often to go to the markets, and they were getting really poor quality material. So could we provide them with some of the know-how, how to collect the material? So one of the first things was to meet up with the traditional healers. Phyllis, the lady in the middle there, was very good with English, etc., so she was acting as the kind of coordinator. So they helped identify the key plants they would like to have grown. We were able to get some money to support the work. Tati is the local charity that we were working with. We managed to get some land, etc. And then we had to go through a series of kind of stages that were not all scientific or horticultural. In the process of doing this, the blessing of the land. Well, we bless the house, etc., often when you're going to move in. But they wanted the blessing of the land. But there was more to it than that. They wanted to have the soil and those aspects of the plants blessed. And, okay, ceremonies, etc. But they were saying, no, you need to do far more to that. And this is a study where we actually took some of the plants, along with the soil, from where they were grown initially, and we put them into that land there, but we also kept some of the plants growing in where they were traditionally. And we found out that some of those plants, if we just put them into this land, didn't have the same type of chemistry that was associated possibly with their medicinal properties. So the importance of soil is something I think we've often neglected. So we end up growing plants, the same species, but it's not of the same quality. And therefore, they could be supplying really inferior material. Now, they knew that, but the way that they were expressing it is not scientific. It was associated with the spirits of the plants. So it's kind of one of those things going in slightly with an open mind and thinking, okay, how do we adapt scientifically to address some of these questions? So we were able to propagate a whole lot of material under different conditions so that they could have supplies. And at that stage, we delivered our project. I'm pleased to say that the project is still going on. They've got material now that they can use instead of having to rely on poor quality material from some of the markets. Another project in Papua New Guinea, one of my team, Tom Prescott, is involved in actually working with the indigenous communities, looking at plants that they use to treat leg ulcers. And in this particular project, he does a lot of it actually in the field, does some of the testing in the field, so everything is, so to speak, on a backpack, and then takes samples back to the UK to do some of, therefore, the chemistry, etc. And then we're working with others now on looking at the mode of action of these particular plants. Give more information about which ones are more effective. Therefore, hopefully, they can work with the local healers, but also some of the hospitals, etc., in Papua New Guinea. Again, we're talking about areas where they don't have access to modern medicine. China. We got involved in China back in the 1990s to deal with material that was coming into the trade. We couldn't help identify it. So when we get queries coming in from hospitals, etc., we were finding it difficult to identify material from roots or bark, etc. What was the species? So a collaboration, very much driven by Chris Leon, with an organisation IMPLAD in China to enable us to go out and collect good quality traditional Chinese medicines, get them from the field. And one of the key for traditional Chinese medicines is the processing. So what we did is we got the raw material from the field and we got sub-batches of that material being prepared in the different ways that it would be prepared in China. Because often it's the way it's being prepared will detoxify the material. Therefore, if it's not prepared correctly, right species, but potentially toxic. So now we have examples of 700 species. So we've got the main ones that are in the Chinese pharmacopoeia, but some of the substitutes, etc., that enables us to help authenticate material that is being researched by students, by companies, etc., who are really wanting to understand more about the efficacy of traditional Chinese medicines. And part of that project was funded by an EU grant, an EU-China grant, to develop good practice in traditional Chinese medicine. I think if there hadn't been a close down in the 19th and 20th century within China, actually some of these plants would be more widely available. But China kind of closed the doors, and it was very, very difficult to get information out. And of course, how they go about the taking material to market in China is very different from us. And so one of the things that was driving their interest in this project is what's required to meet the westernized standards of drug delivery. So what do we need to do to be able to get material kind of recognized, say with the British Pharmacopoeia or the equivalent over in the States, etc. And that was what was behind this project. Ended up 270 scientists in 27 countries working on this. Resulted in, I was responsible for the quality control aspect on this. We had a whole lot of outputs. And next year at Kew, we will have a conference that will bring a lot of this information together because as a result of this project, a society has been formed, very much linked up with China and Europe. Also, the States are involved. So getting science behind it. Now, one of the issues that really was behind an element of this project was when we had deaths associated with people that had taken a slimming potion, especially in Belgium, that contained Aristolochia. Aristolochia contained aristolochic acids, which are thought to be associated with renal failure. Now, one thing in China, you have something like the pinyin name mouton. It's not one species. It actually could be 3 species that could be used. Now, one of those, Aristolochia, contains the toxins, the other 2 don't. And what happened is that somebody used the wrong plant in the medication. It was not somebody with expertise, and that's why we need to have more expertise. It was somebody who thought, oh, mouton, I can use any of these plants. Of course, they couldn't. If you see the actual plants, you won't get things mixed up, but if you see the little bits of either the stems or the roots, they're jolly difficult to differentiate. So here we think, with lack of knowledge, inability to identify it. So there was legislation placed for banning these plants. So they can't be used, including China, Taiwan, etc. We were interested in this because it's a plant that's used widely, and it hasn't really been reported to have toxicity in other areas of the world, especially in South America where you've got more plants. So we did a survey, this was done by Michael Heinrich, of all the ethnobotanical information that we could find in the literature associated with these plants. Many of them having a diversity of uses. This was published in 2010. But we wanted to take it further. So what we did, this is what's termed basis of a chemical analysis. And the toxic compounds of these ones, aristolochic acids, sometimes it works, sometimes it doesn't. Aristolochic acids 1 and 2, those are the ones that are thought to be associated with the toxins. But you can see then not all the species have them, and they vary. And some of these others are also some of the compounds that are thought to be associated with the toxins. So why is it that some of the plants that contain the toxins don't have any report from activity? As a result of this, this paper was published last year, we think that we've missed something out. There is definitely another group of compounds, so we've most likely gone for the ones that were most easier to identify. And there's other things that we need to do, which will most likely result in changing the legislation. So it maybe shouldn't be banning things with aristolochic acid, we need to be banning things with other compounds. Okay, sorry, there's one other example. Antimalarial plants, we've been working for a long time on these, started in 85. Working in Ghana, again, doing ethnobotanical studies, finding out the plants that are used by the traditional communities, etc., in areas where you've got high level of malaria. What's a shame about this particular project is there hardly any expertise within Ghana on antimalarials. So we were having to take material either to Oslo or to London School of Tropical Medicine for testing. So we used some of the information that we gained from this to really make a case for more work to be able to be done in Ghana on the chemistry, because these are the plants that they're using. And so what we did, again, documenting the use of the plants, indicating plants that we have already known compounds that could be associated with their use, but therefore putting that short list of plants that justify further use. Also taking into account how they're used, because that information, sometimes it's not just one plant, it's two. That can give you information about potential doses. You know, how many days is it used? Is it 3 times a day? Is it once a day? What part of the plant is used? How is it? Because sometimes it's bathing, sometimes it's a drink. That's actually very important information to gather. Lastly, I've talked about where we've been, where we're going. It's the first time for Kew. It's set up a spin-out with Cambridge University, and this is to develop antibiotics. There's a great need for that in the past, obviously the famous one with penicillin. And what we're trying to do is to identify kind of the new plant, new leads. I mean, the ideal would be a new compound, new mode of action, etc. But it might be that it's a known compound, but a new mode of action. Our role is on the plant chemistry and the chemistry of the fungi. The role of our collaborators at Cambridge University is very much on identification of the antibiotic, and also we're including looking for compounds that stimulate the immune system, looking at potential routes for humans, but also animals. So it's going to be quite exciting to see where this goes in the next few years. Thank you. Thank you very much.